Hi, sorry. Hi, everybody. My name is Rebecca Brower, and I'm in Public Health 1 with Dr. Bick. And the public health problem that I chose to talk about today is poor air quality. I apologize in advance for my voice in the video. I am sick, and for the awful video quality, I'm not very tech savvy. So the public health problem, why does it exist in society? So there are 6 common air pollutants called criteria air pollutants that are harmful to human health and the environment. The 1970 Clean Air Act requires monitoring and regulation of these air pollutants. Particulate matter is the visible form of pollution such as soot, smoke, and ash. It reduces visibility, creates grime on buildings and streets, and studies show people exposed are more likely to suffer from respiratory symptoms and poor lung function. Sulfur dioxide is produced by the combustion of fuels such as coal. It irritates the respiratory tract and is a precursor to acid rain when it reacts with water vapor. Carbon monoxide is a highly toxic gas produced from motor vehicle exhaust, especially harmful to patients with pre-existing cardiovascular disease, making them more susceptible to heart attacks when exposed. It can also cause headaches and impair mental processes in the brain. This exposure is most common in high traffic congestion. Nitrogen oxides are the chemicals responsible for smog, and like sulfur dioxide, are also irritants and contributors to acid rain. The main sources include on-the-road vehicles, off-the-road equipment, and power plant emissions. Ozone is produced by photochemical reactions where sunlight reacts with other air pollutants such as nitrogen oxides. It irritates the eyes and respiratory system, and chronic exposure can cause permanent lung damage. Ozone is also used as the general measure of air pollution. Last but not least, lead. Lead is a highly toxic metal that can damage the nervous system, blood, and kidneys. Especially in children, it poses a risk to the development of their intellectual abilities. The main source is the use of leaded gasoline. So how did this public health problem come to be? How did it happen? It started in the 18th and 19th centuries with the Industrial Revolution boom and the production of automobiles. Motor vehicles are the primary source of air pollution in urban areas. Where did this problem happen? Air pollution caused by coal burning was a problem in London as early as the 17th century. But air pollution really gained national attention after the unusual weather patterns in the United States in 1948 and in London in 1952 that caused severe air pollution and health consequences. 14,000 residents of the U.S. crisis suffered breathing difficulties and irritations in the nose, mouth, and throat that resulted in 20 deaths. Unfortunately, with the continuum of motor vehicles, power plants, industrial facilities, and mines, etc., poor air quality is a problem that fluctuates all over the world. What are the risks for the community in the future? On the individual level, like I've mentioned before, poor air quality causes respiratory irritation and poor lung function. It can lead to cancer and death, especially in patients with previous conditions like cardiovascular disease. It increases their risk of heart attacks. Some of the criteria pollutants, they affect and impair the brain, the nervous system, the blood. On the global level, like I mentioned briefly, it can cause acid rain. It reduces visibility outdoors. It can corrode buildings and streets. It's depleting the ozone layer. The acid rain destroys forests and crop production, can damage buildings. The depletion of the ozone layer is increasing ultraviolet radiation, which can lead to skin cancer and blindness. The etiological factors, the main cause of this problem is the combustion of toxic chemicals that pollute the air. This combustion, like I've mentioned before, comes from factories and vehicle exhaust. Another factor is indoor pollutants that seem to have almost a larger effect because actually people spend more time indoors than they do outdoors. This pollutant includes aerosols, pesticides, house cleaners, pet dander, tobacco smoke, bacteria, mold, wood-burning fireplaces, chemicals in the drywall and production of your house. There are so many pollutants, such large amounts are getting trapped inside our homes and causing damage that we may not even realize. And these can lead to fatal diseases such as Legionnaire's disease and hantavirus. So how to solve this health problem? Well, Strategies that have been implemented include the Clean Air Act of 1970, which established strict air quality standards, set limits on several major pollutants, and mandated the reduction of automobile and factory emissions that are constantly, and this act and its mandations are constantly being strengthened. The Clean Air Act amendments passed in 1990 contained a number of provisions identifying specific chemicals for the Environmental Protection Agency to regulate. When an area does not meet the air quality standards for one or more criteria pollutants, the EPA may implore measures to force that area to attain the standard. The standard approach for limiting air pollution from motor vehicles is mandating changes in engineering and fuel, in the use of catalytic converters, and the ban on leaded gasoline. A strategy that has been effective in reducing industrial sources of pollution was the Clean Air Act Amendment creation of pollution allowances that can be bought and sold. It sets a nationwide emission goal that is lowered every year, and each potential polluter is assigned a fraction of that amount as an allowance. The elimination of chlorofluorocarbons, known to have created the ozone hole, is another strategy of slowing the poor air quality problem. In this slide, I've provided a photo that lists some more of the amendments to the Clean Air Act that work to control acid deposition, toxic pollutants, establishment of programs, the expansion of enforcement and authority, really just to show an overview of what more the amendments are doing. So, other countries, so for example, Europe, their European Environment Agency, which is similar to our Environmental Protection Agency, their policies are like ours. They're aiming to reduce air pollution through legislation and cooperation with those responsible for the air pollution, like we did with the pollution allowances. They're in cooperation with non-government organizations and research to make a range. They make a range of air pollution data publicly available. They document and assess air pollution trends and investigate trade-offs between air pollution and policy to get political and economic benefits out of cleaning the air. Public health in the future. So the NCBI, an article from the Journal of Thoracic Disease on the National Center for Biotechnology Information, which is a branch of the National Institutions of Health, says that shutting your windows will help protect outside air pollution penetration. It stayed measuring the amount of time you spend inside and the amount of time you spend outside, but there's pollutions inside and outside. But shutting your windows will help protect you from the outside air pollution penetration. And then for indoor pollution, portable or central air cleaning systems will help reduce the accumulation of indoor air pollution. They also recommend avoiding any vigorous and extended outdoor activities during poor air quality episodes and to reduce the amount of pollutants that are inhaled. Wearing respirators can also be a good source to regulate the amount of air pollutant intake, which are more common in urban areas where they have a lot of industrial factories and more air pollution. So my opinion is I think that we could be doing a lot more to reduce this problem instead of letting economics and politics take over. Poor air quality is affecting the health of the people and the environment and making global impacts on Earth itself. And I feel like we're more concerned about the money we'll lose if we try to clean up the air. I think that we should fine cars for idling engines when they're parked, but their engine is on and they're like waiting. That's just letting exhaust and chemicals into the air at an unnecessary rate. I think we should really push for the hybrid vehicles have really been taking off, but I think we should really push for electric vehicles and sustainability. And, if we all work together, we can breathe happy and breathe healthy. Thank you, everybody, and that's the end of my presentation.